to the States of Global Air Report 2024. Those 5 people, not just numbers, they are brothers, father, sister, mother, son. All of them have their unique story and dreams. Globally, more than 99% of population live in the area where air pollution is about WHO quality guidelines. 4.2 million deaths are attributed to air pollution each year. So if someone asks if the impact of air pollution on health is real, if it is tangible, the answer is yes. It's very real, it's already affect all of us. The main question is that what are we going to do about this? The good news is that it is in our hand to prevent, to mitigate the impact. It is in our hand to protect and save lives. Ladies and gentlemen, air pollution is not just an environmental issue. It is a leading health threat that knows no borders. Yes, air pollution has more severe impact to those who are most vulnerable, but with less resources. But do not be mistaken. Air pollution do not distinguish between the social classes, between the richest and the poor. No one will be safe until everyone is safe. Pakistan faces severe air pollution, particularly in urban areas such as Lahore, Karachi, Peshawar, and Islamabad, where smoke level frequently exceeds the safe limits. Last November, IQAI rated the city of Lahore as one of the most polluted cities in the world, with air quality index AQI score 1165, more than 120 times to the safe level of recommended by the WHO. And at some point, the level rose to the unprecedented scale 1900. But what are specific impact on health on our bodies? Among many our impact, air pollution worsens respiratory disease such as asthma, chronic obstructive pulmonary disease, lung infection, particularly among vulnerable populations. Breath, polluted air leading to inflammation, oxidative stress, immunosuppressions, multigenesis in cells throughout our body. The impact, the lung, the heart, the brain, among other organs, ultimately leading to diseases. Due to the small size, some air pollutants are able to penetrate the bloodstream and affect almost every organ of our body. There is suggestive evidence also linked air pollution exposure with increased risk of adverse pregnancy outcome, such as lower birth rate, small for gestation age, cancer, diabetes, and conjunctive impairment and neurological disease. Those health problems in children and adults can occur because both short and long-term exposure to air pollutants. Children, elderly, the pregnant women are most vulnerable to air polluted related disease. On 14th October, the UNICEF and WHO has launched a joint report titled Clear Air and Health Children. 930 million children globally, about 40% of children are daily forced to breathe the toxic outdoor air with pollutant, level 7 times higher than WHO recommended levels. We will have a further discussion about this report today with the UNICEF rep here and in this panel, who are in the panel. This health risk can affect all us outdoor, but also in our household. Both short-term, long-term exposure can be harmful. What are the main pollutants that damage our health? Pollutant with strong evidence for population concern, including particulate matter, PM, carbon monoxide, CO1, ozone, O3, neutral dioxide, NO2, and sulfur dioxide, SO2. Those pollutants are included in WHO Global Air Quality Guidelines, which are accessible online together with limits recommended by WHO. The air pollutant situation compared to WHO recommended limits among the global can be also consulted in WHO Air Quality Standard interactive map. The tool aims to overview the country effort toward achieve WHO Global Air Quality Guideline. The impact of air pollution should not be considered as isolated factors, but in the context of other interrelated impacts triggered by climate changes. For instance, climate change intensifies negative efforts of air pollution through other factors such as extreme weather events, including disease transmission, flooding, water insecurity, and displacement. The World Health Organization, the WHO, estimates between 2030 to 2050, climate change will cause additional 250,000 deaths per year due to malnutrition, malaria, diarrhea, heart stress alone, and this impact worsen the effect of air pollution and vice versa. World Economic Forum report published in 2024 and also warned by 2050, climate change will cause additional 40 million deaths and 12.5 trillion in economic loss worldwide. In countries like Pakistan, rising global temperature, which is also driven by air pollution, increased risk of heat exhaustion and heat stroke and cardiovascular disease, particularly among the vulnerable population, such as children, elderly, and outdoor workers. According to the World Risk Report 2024, Pakistan among the top 10 most vulnerable countries to climate change and other overlapped crisis factors, including extreme weather events such as heat wave, flooding, drought, and air pollution. The impact of air pollution and climate change on health is extensively documented. However, the crucial question is, what action can we take to adapt and mitigate the impact on health? Please allow me to mention a few examples. First of all, climate action will significantly improve public health and reduce emission and enhance sanitation and promote sustainable energy resources and save and improve life and millions. Improve climate resilience and policies such as urban tree covers, cool roofing, and early warning can reduce pollution that cut heat-related deaths by 50%. Ladies and gentlemen, health is the most precious treasures. Without health, we cannot achieve real development and prosperity. Protect our health and health for our children, for global threat, air pollution, is in our hand. We can take action, reverse the situation. If we act without wait to the next crisis, we can protect a safe life. We should not deny ourselves the basic human rights or breathe in clean air. We don't do it for us. I'm sure if we don't do it for us, I'm sure everyone in this room ready to do for our children and grandchildren. Thank you. Thank you. And now we move to this distinguished panelist here for panel discussion. And my first question will go to Dr. Sama, who is Director of Lung Health Program in Indo Hospital. Dr. Sama was Director of Lung Health Program with the Indo Hospital. What is the first-hand experience regarding the impact of air pollution on health? What can be done to address these challenges?
Thank you so much, Dr. Lau, for your question, and special thanks to Dawn Group for the invitation and the opportunity to engage with so many important stakeholders in this very important discussion. So I'm a pulmonologist, and obviously my main concern is taking care of patients and people who have lung disease. So when I first started working in Pakistan about 8 years ago, I was really surprised with some of the things that I was seeing. We know, as you mentioned in your speech, about asthma and chronic obstructive pulmonary disease. These are some of the common chronic respiratory diseases that patients all around the world face. But in Pakistan, I was surprised to see that the rate at which we are seeing COPD in particular was rising very quickly. And also, I was surprised to see that it's so common amongst women. I'm surprised because my training in the UK was that COPD is caused by smoking, and smoking rates are not that high in women in Pakistan. They're probably higher than the figures because some ladies are smoking but they don't like to talk about it. But certainly it was surprising to see a lot of rural women were coming into the clinic and complaining of shortness of breath, wheeze, cough, sputum production, and this is an irreversible progressive disease. So when we did the lung function tests, we found that they actually have irreversible obstruction of their lungs and they have COPD. And it came to me after a few weeks that the most common factor amongst them was that they were using biomass to cook their foods in poorly ventilated homes with the same biomass fuels, wood, etc., to heat their homes in the winter. So I think what I wanted to highlight is that, this is a disease pattern that we were seeing because of indoor air pollution even before it became vogue to talk about ambient air pollution in Pakistan, because that's in the last few years. Before that as well, there's a silent killer that was affecting people here. We've put up some lung function testing in a lot of different primary care centers that Indus Hospital and Health Network is running throughout the country, and finding that patients who are referred to us because they have respiratory symptoms, about 60% of them have asthma or COPD. So that's really a considerable number in terms of percentage. So there's a huge burden of just respiratory disease because of air pollution. But I must mention that it's not just respiratory disease. As you said, it goes beyond the lungs. It makes you more likely to have heart attacks, makes you more likely to have a stroke. It affects your mental health. So there are lots of health-related issues combined and associated with air pollution.
Thank you, Dr. Sama. Now I move very fast. Time is late. I move to ask UNICEF rep regarding the joint report of Clean Air Health Children made by WHO. UNICEF will launch together in the 14th October. Panel.
Thank you, Dr. Dapeng. Pleasure to be with all of you, and indeed this is a crucial conversation that we all need to be engaged with actively, and thank you again to Dawn for bringing us, all of us together around this subject. We've been hearing that air pollution is a direct preventable killer, and what I'm here to say is that children are uniquely vulnerable to air pollution. In fact, air pollution has become now the #2 killer worldwide of children under the age of 5. And Pakistan is one of the most highly polluted countries. That means the children living in Pakistan, including mine, including yours, are all vulnerable to air pollution. Have you ever held in your arms a little baby and noticed how fast they are breathing, how quickly their heartbeat is beating? That gives you a sense as to if their tiny little bodies and lungs are being filled with toxic air, what effect that might be having on their bodies. We've just heard from Dr. Saima about these effects on respiration, but even before birth, it increases the likelihood of stillbirth. It increases the likelihood of premature births, let alone the impact of respiratory diseases, asthma, pneumonia, bronchitis, and much more chronic things also, as we've just heard. This is now the reality for millions of children living across Pakistan. 4 years ago, there were 68,000 children in Pakistan who died, recorded, of air pollution. That's 8 children every hour dying of air pollution. Think about that in daily terms. Don't be numb to those statistics. These are real lives and real families who are being affected permanently. And that's not to mention all of the thousands of children who are affected by illness and who don't succumb to them. Yeah? These are staggering numbers. 10% of the total number of child deaths under 5 due to air pollution are in this country. These numbers are 4 years old, and they're not going down at the moment. They will not go down until there is decisive action that's taken. And there are solutions. We've been hearing about them. It requires investment, decision-making, and concerted action. Yeah? The air pollution is not just affecting children's health. We've also seen how it's affecting children's education. Huh? How many days and weeks over the last year were children forced to learn at home and remain out of school due to the quality of air? It was weeks. Weeks. Imagine the cumulative effect. It's not just the effect on the quality of education and their ability to learn, but it also has a psychological impact and a social one, because children learn best when they are together with others. That is, there is evidence backing that. But it goes deeper than that. Children's brains perform best and learn best when they are unclouded by polluted air. Yeah? Children are reporting suffering from headaches and other kinds of respiratory illnesses that are directly impacting their learning. So what we are saying is that this is impacting not only their health, but their mental health and their ability to learn. And one more point. This crisis is even deeper for those children who are coming from poor communities, who are the most marginalized. They're often near highways, brick kilns, industrial zones, using biomass, like the firewood, the coal, the dung, for cooking, which means that they're facing even greater exposure and the least protection. Clean air should not be a privilege for the few. It's a fundamental right for all and every child. So that's why I'm here to put forward to you that this is also a child rights crisis. It's about the future potential. It's about now and their survival, as well as the future potential of a nation, because nations are built by children, ultimately. Thank you.
Thank you, Vanina. Now I'm just nice to meet DG NASA again. Just visit you double one, double two, and your emergency service academy. And I saw the wonderful job you and the team have done. And could you please share with us, based on your daily work experience with double one, double two, what can you tell us about the impact and air pollution on health and on rescue double one, double two services?
Can I show you a couple of slides?
Yeah.
Yes, I think the most difficult part is when in the end you have to go and rescue. So you've got all this flood and everything everywhere, the water and water everywhere, the health and health problems issues everywhere, and the child who are sick. I think rescuing them is the most difficult part when you're going there. When we have to deal with all of these kind of situations, and what we saw in the earthquake and then subsequently in the years and the subsequent floods, the challenge was building that capacity. Everybody said, can't be done. It's not possible. In Pakistan, a developing country, you're talking about the West, you're talking about 911 or 999. In Pakistan, it's not possible. Today, we became the first team to get United Nations in SARAC certification, as a result of which we're helping the neighboring countries, all other provinces of Pakistan. So this is a capacity that we've been able to build. But the real challenge, if you see the motto above there, it's saving lives, changing minds, and promoting safety. How do we do it? Is it just a thing, or we really need to? So those are, I'm just going to share 3 or 4 slides, just how we're going to be doing that and what's the vision for the future. This is an integrated emergency services model, so where we're providing all services, because it was very easy to say we don't deal with that, but who else is going to respond? So we ended up with ambulance rescue, fire, hazmat, animal rescue, everything that you, so they're all emergency. Next. This is, we're training all provinces of Pakistan. Next. Next. So about 26,000 people trained. Next. Now this is the real challenge that we face. The data, the emergencies that we face today. So if you see the overall number of the emergencies that we are dealing with, so this is a huge number that we had to deal with up till now, which is about, we have responded to about 16 million plus emergencies and rescued about 18 million plus victims, maintaining an average response time of 7 minutes, which is WHO standards. And with the motorbike rescue service, we brought it down to 4 minutes in the cities, which is today, we just completed, it's about the 8th anniversary. So it was 3.8 million with an average response time 4 minutes within the urban centers, which is an achievement internationally. If we come to the next slide, I'll just show you the number which we have to face every day. So on daily basis, it's about 7,000 emergencies that we're responding to. The bulk number is, as you've said, medical. It's the kids, the children, the adults who are being affected. And even more bigger issue that we also face, where also the children are traveling on motorbikes and others, the underage and others. So the road traffic crashes, every 1 minute there is a road traffic crash. And I think that has become a huge problem. So these are all these problems, cities which are not safe to live, You've the roads which are not safe. So what do we do? All these multiple problems, is there a solution for them? Next. So if you see the smog, the way the road traffic crashes went up 31%, and at the same time, the medical emergencies with smog went to about 82%. So if we, in the years each one, 24, 64, and then 82. So this is 21, 22, and then the year 2023. So this is the data that we looked at when we were analyzing the data. So this was the condition. Now what do we do? Is there a solution for it? How do we rescue? How do we get out of this situation? So there were two things that we did. Number one is engaging the community. So we have a level 1 and a level 2 and a level 3 where we have a community emergency response team in every Union Council of Punjab now to bring about a behavioral change and to become the first responders in every city. Next. So this is where first aid, fire safety, and then road safety, health and safety, and then the clean environment. So now this, we're trying to make it a part of every school. So every school, this training will be imparted, and there are about big numbers now. We're going to every school, every college, and everybody is, the university students are being encouraged to come and participate in these so that they can bring about a sustainable change in the entire process. But the next. The other challenge that I've actually talked about is we have a win-win situation where we save two people. We save from the environment as well as from the injuries. So if we see, this was a great opportunity as well, where we were talking about high-speed bikes and a road traffic crash every 1 minute of a motorbike. At the same time, when we looked at the speed data and the environment data, so the interesting thing was you move to an e-bike with a top speed of 50 and 30% reduction by 2030. So you can imagine the 30% we achieve the climate change target as well as the UN target for reduction of road traffic deaths and injuries. So this was an ideal whether just by this one intervention we could bring about the change. And in the end, next. Now, this is a challenge that we face. This was the challenge that we faced this year. You look at the corner over there, the recent floods. So if we're going to be building in the floodplains and we expect that they won't be affected, it's not safe, sustainable development. Next is the poor quality. Then we have the food security issue. And then we have the environmental degradation. So all of them linking. So what is the solution? I think the most important area where we really need to intervene is whether we want to have those kind of crises or ultimately move to an area where we have sustainable transport, safe transport, cities which are livable, smart cities. So without the land use planning, if we don't do it, you will be faced with all the challenges that we have seen at the back. So I think this is the time, this is where we really need to think where we want to have our cities. I remember Lahore, when we started the service, it was just 6 stations. Today, even 22 are not enough. The air was clean 2004. Today, the air is not clean. We lost 2 or 3 of our drivers last year because there was smog. They had to respond to an emergency. There was this trolley standing right there, and they unfortunately lost their life in the line of duty. So I think that is a crisis. That is an emergency that we're facing. So we need to decide that if we're going to keep our cities livable, smart, or we're going to be faced with crises like Karachi, Lahore now becoming a mega city, then Islamabad becoming a mega city where you've got water problems, crime, you've got transportation issues, you've got all number of problems. So that's something that we need to decide today, and we need to plan properly so that all future problems we are safe and we can have smart cities where we can breathe, where we can, so better to live, work, and travel. So thank you, and I think thank you all. Thank you.
Thank you, Dr. Nazeer, and very comprehensive evidence to say the impact of pollution to people's health and to service, your service. And you actually, I was going to ask you a second question. What are you recommending here? It seems you already present here. So now I will not ask a second question on second round. And now I go back to Dr. Sama again. what are the main three facts about air pollution and health that population should aware, you as a clinician? Could you please also share with us three main prevention measures you would recommend to everyone to mitigate the impact of the air pollution at the individual and family level?
Thank you. So, thanks for that question. I think we have to think about it in terms of a short-term and a longer-term adaptations that we need to make to be able to handle air pollution, because we've heard about how the solutions are going to take time to have effect. I think in the immediate case, we have to be aware that if we have, well, I think we should be looking at AQI levels every day as if they're the weather report, so that we're acutely aware of what happens when we go out of our house and what happens if we want to exercise outside our house, and how we need to modify those activities if the AQI levels are poor. So you may like to wear a face mask, for example, try and use an N95 if the AQI levels are very bad, and especially if you have some kind of chronic disease. So if you already have asthma, or you have COPD or heart disease even, you should be wearing an N95 in bad air quality levels. You should even think about whether you really need to go out that day. You really need to be in that environment at that time. Of course, AQI levels can change throughout the day, so there may be other times in the day that it's better to go out. Just like we would go out to play a football match during heavy rain, we shouldn't be playing football when it's very bad air quality. There is interesting evidence that if you are well and you don't have any chronic disease, you're not a young person who we've heard are at special risk or very elderly, then exercising, especially exercising to go to work or as a form of transport, so using a bike or walking, can actually be better despite the poor air quality outside, because you're benefiting from exercising your body at that particular time. But this is not the case for all people. And I think we, you know, as well as the high sensitivity air groups, we know that Pakistan's air quality levels are not really there that we can compromise and start walking on the street to try and gain the value of exercise. Rather, you can go to the gym and benefit yourself by looking at these other risk factors for chronic disease: exercise, nutritional intake, and your tobacco use, which is another big driver for chronic disease. I think the other thing I want to say about personal level immediately is that if you are having frequent symptoms of poor health, so you're frequently getting chest pain and you're frequently getting breathlessness or cough, you should see your doctor, because maybe actually you have asthma or COPD or some kind of disease that should be treated. And in those situations in particular, but I think that many policies now advocate this as well, you may like to take immunizations for flu as the winter season comes. Pneumonia vaccination is also available, but flu vaccine should be taken every year. And it is going to help to protect you, especially if you have chronic disease. There's well-established evidence to support this throughout the world. So those are some important things that we should be looking every year as the air pollution season increases. But I think in the longer term, we've heard a lot today about sensitization and an understanding. So looking at AQI and understanding how that connects to your health is really important. And we found last year, when we went and asked a lot of adolescents about this, that people were not really very clear between the relationship between air pollution and health, even though in a day like today, we have really been able to talk about it repeatedly and talk about it in a convincing way. But there's a huge population of people who are not so clear about this, and there needs to be many more sensitization activities at multiple levels, some of which are already going on. We did one that's just recently completed on social media, focused at young people who are ultimately the change makers of our society. Thank you.
So much. It's very valuable advice for the people in the also individuals, a family. And now I go back to Panina again, and you give us a very interesting insight of the impact of pollution to children's health. Could you tell us more about the main recommendation to reverse the situation and build a healthy future for every child in Panina?
Thank you, Dr. Dapeng. First of all, we need prioritization. Air pollution must be treated as a national priority and an emergency, not just a public health one, but also a social one and a child rights one. This is fundamental. Until it's treated as a national emergency, it won't receive the attention that it requires. It'll be piecemeal rather than a more holistic and transformational approach. We also need to enforce and adopt the air quality standards that are recommended by the World Health Organization and have the monitoring systems in place to ensure that those are also adhered to. These are the basics upon which we can then monitor on a daily basis and start creating that awareness. Speaking of awareness, every child and person in this country should be aware of not only what air pollution is, but on also the concrete actions that they can take at a household and an individual level and a community level to address it. It needs to be included in the school system, in the curriculum, whether it's public or private. But let's not forget there are 26 million children who are of school age who aren't in school, but they too need this information. It has to be known at a community level. So every single community, whether you're in a rural community in Balochistan or you're in an urban slum of Karachi, you need to know about this and be equipped with the awareness to know what to do about it. There are many solutions that are available that can tackle the specific contributors, whether that's the transportation industry, whether that's the agricultural industry, whether that's urban planning and having planting more forestation and parks. There are so many solutions out there, but it requires a concerted plan of action that is really going to the heart, and that takes people into its account. There is strong evidence in so many areas that when people are aware, they will themselves take action at the individual level, which will contribute positively to the change. It is not sufficient, but it is a vital aspect of the solution. So let us invest in those, and UNICEF stands ready to continue to partner with government, with society, with civil society in those solutions, in that forward action.
Thank you. As I say, Nazeer already answered the second question I asked him. So I want to thank all the distinguished panelists for the very fruitful discussion. I'm sure our audience will take this valuable insight into consideration, continue building a health future for children. As I said at the beginning of this panel, save life, offer a health future for our children and our grandchildren is in our hand. Shukriya, thank you. Thank you, everybody. Patience and for still here. Thank you.
Thank you. Yes, patient.
Thank you to our panelists. Ladies and gentlemen, as we conclude the air we breathe, we are reminded that clean air is not a privilege. It is a basic human right. Today we have heard from leaders, experts, and citizens who have shown us that solutions exist, but solutions demand commitment. The choices we make as policymakers, as businesses, and individuals will determine whether future generations inherit skies filled with smog or skies filled with possibility. On behalf of Dawn Media and Breathe Pakistan, I thank our speakers, our partners, and all of you for being a part of this critical conversation. Let us carry today's dialogue beyond this hall into policy, into action, and into daily life, because the air we breathe cannot wait. Before we close, I am delighted to share that the Breathe journey continues. Our next gathering will be at Breathe 2026. The upcoming conference will build on today's dialogue, expand regional collaboration, and showcase innovative solutions to secure a cleaner air for all. We look forward to welcoming you once again at Breathe 2026 and to keeping this important conversation alive. This concludes our conference. Thank you. One last announcement. We found a key. If this belongs to you, please get in touch with one of the Dawn organizers.